Next is about Dhoomanasyakavala graha chikitsidam vyakhyasyamah yathovacha bhagavan dhanvantarihi. The Dhoomaha panchaviduh bhavati tadyata prayogikah snayikah vairechanikah kasagmo amaniyastheti. Dhoomapana is one of the unique method of administration of the drug mentioned in Ayurvedic texts, and the types of this, about this, there is a slight difference of opinion in different texts as such. Sushruta has mentioned about the 5, and these are the Prayogika, Berejanika, Snehika, and Kasagna, Vamaniya. Whereas in Charaka there are the 3 categories. Of course, there is not much of a huge difference in the total outlook, but the issue is there is a bit of difference in the nomenclature. Charaka has mentioned Prayogika, Berejanika, and Snehika, and Asanga there is Snigdha, Madhyama, Tikshna, and Asanga Sangraha, Samana, Shamana, Brahmana, Shodhana, Vamaka, Vranagna. These are all the names of these types of the Shirovilechana or Dhumapana mentioned in the different texts as such. Now, the preparation of the Dhumapana. The Dhumapana is not directly smoking as it is done now. So, see, what happens is when you translate the Dhumapana into smoking, it gives a rather different sort of impression, something like addiction form. But the Dhumapana mentioned in Ayurvedic text is much more than smoking. It's not only smoking. It's a method of drug delivery. It's a pharmacological method of drug delivery where the drug is directly administered into the respiratory tract, as we do it now in case of with this different sorts of fumigation techniques. It's not only even not the fumigation techniques, is a respiratory system. There is a method of direct administration of the drug into the respiratory tract. Now you may have that fine particles of the vapors. The vapors of different drugs are now administered with the different instruments. Now you have different sorts of the instruments, whereas the Dhumapana is a primitive instrument by which the drug would be administered. It's not simply smoking. So translation of Dhumapana as a smoking may give a different sort of impression. The technique of Dhumapana is Tatra Yeladina Kushtha Tagara Varjena Shlakshnapishtena Dwadashangulam Sharakandam Anguri Parinaham Shaumena Angusta Ashtangulam Vesaitva Lepayet Esha Vartihi Prayogike Sneha Palasara Madhuchista Sarjarasa Gugulu Pravritibhi Snehamistrihi Snehike Shirovilechantravihi Vilejane Brihati Kantakarika Trikatu Kasamarda Hingu Ingudi Twak Manashila Chinnaruha Karkadashungi Pravrivi Kasa Hareshcha Kasagne Snayu Charma Khura Shunga Karkatakasti Shushka Matsya Vallura Krimi Prabhuti Vamani Yeshavamani. Now, the preparation of the Dhuma as such Varti is that you need to have a thin rod of any dry plant, and Sushil says it should be Kusta Tagaravarjena. It should be something beyond other than that of the Kustatagara. A Sharakanda. A Sharakanda is a bamboo stick is used in the middle, and over that bamboo stick the lepa of drug is applied with the cotton, some amount of cotton fibers, and the drug is mixed together and that's applied over the area. The selection of the drug would be according to the users. Like if it is Prayogika is something where it is given to healthy persons and the person would be having some, again I won't use the word habit of smoking, but used in a healthy person as such, without any specific therapeutic purpose. That's the Prayogika. In such conditions, you should not use any of the Tikshna Dravyas, and it should be only the Mrudu Dravyas. Then Snehika Dhumapana, for the Sneha, it should be the drugs which are selected as Sneha Palasara Madhuchista etc., Gugulu etc. For the Vilechana Shiro Vilechana Dravya, and for Kasagna Brihati Kantakari etc. For the Vamaniya, to induce the Vamana, all the animal products, different animal products are again pasted and applied that leather or skin or maybe the horns of animals, etc., or dried fish. These are applied over. Now this is how the whole thing is prepared. You will have a sharakanda, that the wooden piece in the middle. Then the medicine is applied and allowed to dry. And as it gets dried up, that sharakanda, that wooden piece, would be removed. So you will have a hollow pipe-like structure which is medicated, and this has to be burned. Now, interestingly, such drugs are now available. Dhumapana Varti is available in the market. In Amazon, you get it for rupees 500 for one Varti. I don't know which are the medicines used there, but exactly similar technique of preparation is used, and such a drug is available in the market. So, that's a very interesting issue. Then the Varti has to be used in an instrument which is used for the Dhumapana. The instrument used for the Dhumapana are the Basti Netra Dravyahi. Dhuma Netra Dravyani Vyakhyatani Bhavanti. Dhumanetram tu Kanishika Parinaham Agre Kalayam Matra Sroto Mule Angushtha Parinaham Dhumavarti Pravesha Sroto Angulani Ashtatatvarimshati Prayogike Dvatrimshatu Snehane Chatrivimshati Veretane Shodashangulam Kasagne Vamaniyeja Yete Kolasti Matra Chidre Bhavanti Vrananetram Astangulam Vranadhupanartham Kalaya Parimindadam Kulathavashistvotraha Iti. Now the smoking or the administration of the drug, again the word of smoking is not really the proper word, but the administration of the drug would be by lightening it, by burning it, and that burnt products, the smoke is taken in through a tube, and that tube would be, the length of the tube is one of the important decisive factor about the utility. When it is for the prayogika, that's for the healthy person without any medical purpose, the length of the tube is Ashtatvarimshata, 48 angulas. So it's something like around 2 to 3 feet long. Something like the hookah which is used like. And the Dvatrimsha Snehana, if it is for the Snehana, it should be 32 angulas. And if it's Virechana, it's 24 angulas. For Kasagna and Vamana, 16 angula. The logic behind this is, longer the tube, the amount of the smoke, the hydrocarbon, which is taken in would be lesser. Shorter the tube, the hydrocarbon taken would be more, and it would have more potent activity. So, to reduce or increase the potency of the drug which is taken in, the length of the tube is altered. Different sorts of such materials are available. Based upon the description of what's mentioned in the text, in Samhita, it could be a simple straight tube. But majority of the instruments which are used for this Dhumapana, they would have a water filter. A water container is there, and then the smoke would be passed through that water filter, by which again the potency can be reduced. Many of those irritant substances can be dissolved. So the different sorts of the instruments which are used practically are having that water filter like structure, and the tube is connected to that, and then the Dhumapana is done. And of course, based upon the text, you may have a straight tube. So in some centers still they use that straight tube. In majority of the centers they use this tube with the water filter. Now that tube with the water filter is not really mentioned in Sushil Samhita as such. Anyway, that's about what we use now. And the dimensions of the tube again would be as thin as a Kanishika Parinaha, as thin as that of the small finger, and the lumen of the tube would be as that of the total Kalayadhanya. Whereas for Vranadhupana, now Sushruta mentions about a Vranadhupana, which is not again a type of the Dhumapana in the initial Dhumapana category. So Vranadhupana, because it is not Dhumapana, it's a Dhupana. So Dhumapana and Dhupana, these are the two different issues. Dhumapana, where you will take in into the respiratory tract, whereas Dhupana is a fumigation. So it's something like nebulizer and fumigation, something of that sort. I won't use the word translate again as it nebulization, but the technique of nebulization is a replica of the Dhumapana, and that is a different issue. Vranadhupana is a different issue. For the Vranadhupana, the thickness of the tube would be as that of kalaya, that seed as such. अथ सुखोपविष्टः सुमनः ऋजु अधोदृष्टिः अतन्दितः स्नेहात् दीप्ताग्रं वर्तिं नेत्रस्रोतसि प्रणिधाय धूमं पिबेत् मुखेन तं पिबेत् पूर्वं नासिकाभ्यां ततः पिबेत् मुखपीतं मुखेनैव वमेत् पीतं च नासया मुखेन धूममादाय नासिकाभ्यां च न निर्हरेत् तेन हि प्रतिलोमेन दृष्टिः तत्र निहन्यते विशेषतस्तु प्रायोगिकं घ्राणेन आददीत स्नैहिकं मुखनासाभ्यां नासिकया वैरेचनिकं मुखेन एव इतरो. Now, the technique of Dhumapana is the lightened that wick of medicine is kept in the tube, at the tip of the tube, and then the person would be sitting comfortably, and his eyes should be looking downwards, and the tip of the tube should have some snehadravya, some oily substances applied over, and then you have to consume the dhuma, that the smoke has to be consumed. Suck the smoke would through the mouth, and the tube, that smoke which is sucked through the mouth has to be exhausted out or excited out through the mouth only, or the next, and the first would be always from the mouth. The following that you may take the smoke through the nose. So the two inlets could be mouth and the nose, and preferably it should be from the mouth, and whenever the smoke is consumed through the mouth, it should be excited out through the mouth only. It should not be excited through the nose. If it is excited through the nose, it can harm the eyes. Tenahi pratilomena drishtihi tatra nihanyate. So those who smoke the cigarettes, they should know this now the present issue. And of course, if at all you have to take consume cigarettes, it should be 48 angulas long. It's not that short cigarettes. And for the prayogika, the normal persons to take the smoke as what we call as the habitual smokers, maybe not exactly. The smoke has to be taken through the ghrana only, through the nose only. And for the snehika dhumapana, for snehana, both nose and mouth is used. For the virajnika dhumapana, again nasikaya, through the nose only. And in the other conditions, it should be through the mouth. Tatra prayogye vartim vyapagata sharakanda nivata atapashushkam angareshu adipya netram moola srotasi prayujya dhumam ahara iti bruyat evam snehanam vairecharam च कुर्यात् इतरयोः व्यपेत धूम अंगारे स्थिते समहिते शरावे प्रक्षिप्य वर्तिं मूलच्छिद्रेण अन्येन शरावेण पिधाय तस्मिन् छिद्रे नेत्रमूलं संयोज्य धूमम् आसेवेत प्रशान्ते धूमे वर्तिम् अवशिष्टां प्रक्षिप्य पुनरपि धूमं पायेत् आदोषविशुद्धये एषः धूमपान उपायविधिः. Now prayogika dhumapana as well as the snehana and vairechanika dhumapana, the tube is used, and that a pot is contained, and the pot is connected tube, and over the pot you will have some hot coal, and over that the varti is kept and varti is lightened so that the smoke will pass through. For the other varieties of dhumapana, instead of having a tube, you may you may have a vessel, and in the vessel you will keep the hot coal, and over the hot coal you will keep this dravya, the tube, and then again cover it with another lid, and whenever you have to take the smoke can be directly taken by opening the lid. That tube is not necessary. That's what that gives a higher intensity of the smoke. For the other varieties like Vamana and Kasagna, directly the smoke can be taken without the tube. तत्र शोक श्रम भय अमर्ष औष्ण्य विष रक्त मद मूर्छा दाह पिपासा पांडुरोग कालुशोष छर्दि शिरो अभिघात उद्गार अपसर्पित तिमिर प्रमेह उदर आज्ञान ऊर्ध्ववातार्थाः बालवृद्ध दुर्बल विलिप्ताः आस्थापिताः जागरिताः गर्भिणी रूक्ष क्षीण क्षतोरस्क मधु घृत दधि दुग्ध मत्स्य मध्य यवागो पीताः अल्पकफाश्च न धूमम् आसेवेरन्. Those who do not have a kapha prakopa and those who have the other list of the disease conditions. It could be like emotional disturbances, thirst, and so on. The dhumapana is a contraindicated, should not be given. अकालपीतः कुरुते भ्रमं मूर्छां शिरोरुजं घ्राणश्रोत्राक्षजिह्वानाम् उपघातं च दारुणम् आद्यास्तु त्रयो धूमाः द्वादशस्सु कालेषु उपादेयः तद्यथा क्षुतदन्त प्रक्षालनस्य स्नानं भोजन दिवा स्वप्न मैथुन छर्दि मूत्रोच्चारहसि उचित शस्त्रकर्मान्तेषु इति. Now the dhumapana should not be done without specific indication and without the proper methodology. If that proper methodology is not followed and when it is not done with a specific indication, it can harm the sensory organs like the nose, ears or eyes and so on, and hence they should not be taken. For whenever there is an indication, the indication could be at maybe at any time of the day or certain specific sequences when the dhumapana is indicated, or they are categorized into 12 categories. That's where Kshutadanta, after cleaning the teeth and after prakshalana, mouthwash, after nasya, after taking bath, after food and after daytime sleep, after sexual indulgence, after an episode of vomiting, after evacuation of the bladder, or after in the morning, immediately after getting up from the bed in the morning, and after the surgical incidences. These are the conditions which can be where the dhumapana is indicated. There again, the further classification is mutrochara kshavatu hasita rushita maithuna esho snehikaha. After mutrochara, after the evacuation of the bladder, or after sneezing, after laughing, or maybe after the sexual indulgence, it could be snehika dhumapana. Snana chardana diva supnanteshu vairejanikah. After the bath or after the vamana or after the daytime sleep, it should be vairejanika dhumapana. Danta prakshalanasya snana bhojana shastrakarmanteshu prayogikaha. The prayogika without specific indication can be done after cleaning of the tooth, after snana bhojana, or after the surgical indulgence. Tatra snehiko vatam shamayati snehad uparepacha vairejanah shleshmanam utkleshaya apakarshati रौक्ष्यात् तैक्ष्ण्यात् औष्ण्यात् वैशद्याच्च प्रायोगिकः श्लेष्माणम् उत्क्लेशयति उत्कृष्टं च अपकर्षयति शमयति वातं साधारणत्वात् पूर्वाभ्याम् इति. Now the specific indications are when there is a vata visheshan, sanika dhumapana is indicated, and when the kapha utklesha has to be done and the utklishta kapha has to be expelled out, it should be vairejanika dhumapana because of its property like ruksha, tishna, ushna guna, it expels the kapha. Prayogika dhumapana also aggravates the kapha. Then utklishtam japakarshati, it expels out. It's a shodhana for the kapha as such. And bhavati jatra naro dhumupayogaccha prasanna indriyavanganaha dhridakesha द्विजश्मश्रुः सुगन्धि विषदाननः तथा काश श्वास अरोचक आस्य उपलेप स्वरभेद मुखास्राव क्षवतु वमतु क्रथ तन्द्रा निद्रा हनु मन्यास्तम्भाः पीनस शिरोरोग कर्णाक्षिशूलाः वातकफनिमित्ताश्च मुखरोगाः न भवन्ति. A regular practice of dhumapana can help in improving the functions of the sensory organs. The hairs will become stronger. Even the facial hairs also will become quite fine as such, and the whole face would be looking very healthy. The diseases like cough, breathlessness, or dyspepsia, and coating of the tongue, or hoarseness of the voice, or excess of salivation, sneezing, vomiting, and the excess of sleep, or then the improper movement of or rigidity of the mandibular joint, cold as such, or the nasal discharges, headache or diseases of the head, or the ears or eye pain. These would be can be prevented by regular dhumapana. Tasya yoga ayoga atiyogaah vijnatavyaah. Tatra yogo roga prashamanah ayogo roga aprashamanah. कालुगल शोष परिदाह पिपासा मूर्छा भ्रम मद कर्ण क्ष्वेड दृष्टिनाश दृष्टिनासारोग दौर्बल्यानि अतियोगो जनयति. The yoga, ayoga and yoga, proper use and improper results of the Dhumapana would be, if it is done properly, the disease will be reduced or disease will subside. If it is done below the optimum level, the disease would not get cured. And if it is done in excess, it can result in dryness of the mouth, burning sensation, excess of thirst, even impaired consciousness, or the discharges from the eyes and ears, or diseases of the ears, eyes, nose can occur, can be produced. Prayogikam त्रीन् उच्छ्वासान् आददीत मुखनासिकाभ्यां पर्यायं त्रीन् चतुरोवाति वेति स्नैहिकं यावद् अश्रुप्रवृत्तिः वैरेचनिकम् आदोषदर्शनात् तिलतण्डुलयवागोपीतेन पातव्यो वामनीयः ग्रासान्तरेषु कासग्नः इति. Now the how much of the quantity of the dhumapana is for a prayogika dhumapana, only 3 breaths, not the whole cigarette. So only 3 breaths have to be taken. 3 uchvasan, 3 inhalations have to be done. Mukhanasikabhyam, both from the mouth or from the nose, it may be. Or in case of other conditions, it could be 3 in chaturava, 3 or 4 as such. Snehikam, in a snehika dhumapana, till the tears come out. In vairechanika dhumapana, till the doshas, the phlegm comes out. And in the vamaniya dhumapana, it should be after consumption of the yavagu, the liquids of tilatandula, etc. And then it induces vomiting. For kasagna, in between the food, after consuming the food, in between you have to have the dhumapana. Vranadhumam sharava samputa upanitena netrena vranamanayeet dhumapana udvedana upashamo vrana vaishadyam asravo upashamascha bhavati vidihi esha samasena dhumasya abhito maya nasya sasa pravakshami vidhim nirabasheshatah. Vranadhupana, again you have to have a sharava samputa, 2 vessels, 2 parts which are covered with, and the dhuma has to be produced, that hot coal has to be placed, and the drugs have to be kept in, and it's sort of a direct fumigation of the wound, which helps in clearance of the wound, and the discharges of the wound also will be reduced, and that's about the dhumapana. The next is about nasya. Aushadham aushadha siddho va sneho nasikabhyam jyete iti nasyam. Nasya is a drug either along with the sneha or directly the medicine, or a medicated sneha can be applied or administered through the nose, and nasal administration of the drug is nasya. Nasal administration of the drug is one of the established pharmacological route which is now used, and the major advantage of that would be it bypasses the hepatic metabolism, and hence the drug would be available directly into the system without undergoing the decomposition in the liver. Majority of the drugs, they are metabolized in the liver, and those drugs which get completely metabolized in the liver, if it is swallowed, the benefit would not be seen, the pharmacological activity would not be seen. So if it is administered through the nose, it bypasses that hepatic metabolic activity, hepatoenteric effect, and hence it produces effect. That's one of the major advantage, and that's a very established pharmacological route of administration. Of course, according to Ayurvedic principle, because it is very closer to the brain, it reaches the brain early. Now whether it reaches the brain, crosses the blood-brain barrier or not, this is a controversial issue. Of course, lots of such studies also are done. Nasal administration of the drug, whether it has a higher, whether it gains higher concentration in the brain or not, that kind of experiments are done, and the results of the experiments are somewhat ambiguous. It could be both the ways. So no definite evidence that it would have a impact on the brain much more than others. That kind of an issue is not proved completely, but not disproved even. Anyway, the types of nasya are, according to Sushruta, primarily they are of 2 categories. Shiro Vidachuram Sneham Cha. Tad Dvividhamapi Panchada. Again, that could be categorized into 5 categories. Nasyam, Shiro Vidachuram, Pratimarshaha, Avapidaha, Prathamanam Cha. That 5 categories would be based upon either the quantity of the drug which is administered or the method of technique of administration. Teshu, Nasyam Pradhanam Shiro Vidachuram Cha. Nasya is a pradhana, the most important, and it's a Shiro Vigachana also. Nasya Vikalpaha Pratimarshaha is one of the different technique of the Nasya. Modified Nasya is the Pratimarsha. We will come to that individual descriptions later. Shirovilachana Vikalpa Avapedaha. Avapeda Nasya is alternate to the Shirovilachana or a modified type of Shirovilachana. Pradhamanam. Pradhamana also is one of the Shirovilachana variety. Tasya Nasya the Panchara Niyamitaha. These are the different types of this 5 types of the Nasya. We will have more description about this in due course of time as we go further. Tata yaha snehanartham shunyashirasam grivaskanda urasam cha balajananartham drishtiprasadjananartham va sneho vidhiyate tasmin vaisheshiko nasya shabdaha. Nasya word specific, that see Nasya can be as a general one for all the administration of the drug through the nose, as well as one of the subtypes of that Nasya. That subtype of the Nasya is where the purpose is to improve the general condition of or improve the strength of the ENT organs, ear, nose and so on, and to improve the vision, where sneha dravya, some oily substance is placed into the nose, that's Nasya. Tattu deyam vatabhibhute shirasi danta kesha shmashru prapata daruna karnashula karna kshveda timira swaropaghata nasaroga asyashosha avabahuka akala vadiparita pradurbhava daruna prabhudeshu vatapaitikeshu mukharogeshu anyeshu cha vatapittahara dravya siddhena snehena iti. The indications for the Nasya where directly the oil is put in, a few drops of the oil is put in into the nose. It should be in Vataja Vyadhi involving the head or involving the diseases where the teeth, hairs or the facial hairs are affected and they are have become fragile, or the patient or persons who have pain in the ears or wax in the ear or the vision abnormalities, hoarseness of the voice, any other nasaroga, any other diseases of the nose, dryness of the mouth, shoulder pain, patients have frozen shoulder like conditions, akalavadi parita, immature or premature graying of the hairs, are those who do not have excess of sleep and not find it difficult to wake up, or in Vata Pittaja Vyadhi or any other Mukha Rogas, the Sneha Nasya is indicated. Shirovirachanam to Shleshmana Abhivyapta Talu Kanta Shirasam Arochaka Shiro Gaurava Shula Pinasa Ardhava Betaka Krimi Pratishaya Apasmara Gandhajnaneshu Anyeshu cha Urdhajatrugadeshu Kapajeshu Vikareshu Shirovirachana Dravehi Tatsiddhena Vasnehena iti. Tatra Etad Vividamapi Abhuktavato Annakale Purvane Shleshmaroginam Madhyane Pittaroginam Aparane Vataroginam. The Shirovirachana is again a oily preparation which can be given directly, or certain of the Vairachanika Dravya, Tishna Dravya can be directly administered into the nose, and the purpose is Kapaja Vyadhi has to be tackled, and wherever the patient has a Kapaja Vyadhi involving the Talu Kanta Shiras, the upper organs of the body, or heaviness of the head, or penasa, chronic nasal discharges, ardhavapetaka, that hemicrania like conditions, apasmara gandhajnana, those who have impaired consciousness or seizures like activities, and anosmia like conditions. In such conditions, the Shirovirachana Dravya could be useful, and the timing would be in all that Nasya should be given in empty stomach conditions just before the food, and Shleshmaroginam Purvane, for the Vata Vyadhi, Kapaja Vyadhi, it should be in the early morning. For Pittaja Vyadhi, in the middle of the day. Vata Vyadhi, it should be at evening hours as such. Atha Purushaya, Shirovirachaniyaya, Tekta Mutra Purushaya, Bhuktavate, Vyabhre Kale, Danta Kasta Dhumapanabhyam, Vishuddha Bhakta Srotase, Paditapa Paristvinam Rudita Gala Kapola Lalata Pradeshaya, Vatata Paralohine, Veshmani, Uttana Shaine, Prasarita Karacharanaya, Kinchit Pravilambita Chirase, Vastrachadita Netraya, Vamahasta Pradeshini, Agra Unnamita Nasagraya, Vishuddha Srotasi, Dakshina Stena Sneham, Ustambana Prataptam, रजत सुवर्ण ताम्र मणि मृत् पात्र शुक्तीनाम् अन्यतमस्थं शुक्त्या पितुना वा सुखोष्णं स्नेहम् अद्रुतम् आसिञ्चेत् अव्यवच्छिन्नधारं तथा यथा नेत्रे न प्राप्नोति। स्नेह अवसिच्यमाने तु शिरो नैव प्रकम्पयेत्, न कुप्येत्, न प्रभाषेत् च, न क्षीयात्, न हसेत् तथा। एतैर्हि विहतस्नेहो न सम्यक् प्रतिबध्यते। ततः कास प्रतिश्याय शिरो अक्षिगतसम्भवः। The technique of administering Shirovilachana Sneha, where the quantity of the Sneha Dravya is more, is the patient has to evacuate the bowels and bladder, and after consuming some light food, and a right day has to be selected. The mouth has to be cleaned with the Dantakasta, Dhoomapana, etc. And then you have to warm the temporal area with the panitapat, with the hands rubbed as such, and the patient should be made to lie down in a properly ventilated room, and should lie down flat. The hands and legs should be extended. The head should be just extended further. Pravilambita Shirase, the head should be extended. Eyes should be covered with a cloth, and you hold the nose with the left hand, and with the right hand the Sneha Dravya, which is warmed with over water, has to be dropped in through any vessel, a specific vessel, that Shukti or Rajata Swarna Tamra. It could be either golden or silver or maybe copper, or even earthen pots could be used, vessels should be used, or it could be a wick also could be used. The warm taila has to be poured in continuously as a continuous flow without affecting the eyes. During that sneha, that administration of the nasya, patient should not move, should not become angry, should not speak, should not sneeze, and if at all the sneezing or other movements are done, it can result in kasa, pratishaya, shiro, akshigata roga can occur. Tasya pramanam, the quantity would be अष्टौ बिन्दवः प्रदेशिनी पर्वद्वय निःसृताः प्रथम मात्रा, द्वितीया शुक्तिः, तृतीया पाणिशुक्तिः इत्येताः तिस्रो मात्राः यथाबलं प्रयोज्याः. So for the Shirovilachana Sneha, the alpa matra is 8 drops, and one shukti is for the middle or medium dose, and higher dose would be panishukti, a fistful of the drug. Quantity is increased. This would be according to the strength of the patient and the indications. Most of the times you cannot just apply more than 8 drops practically. स्नेहनस्यं न उपगदेत कथञ्चिदपि बुद्धिमान् शृङ्गाटकम् अभिप्लाव्य निरेति बदनाद्यथा कफोक्लेशभयाब्चैनं निश्चीवेत् अभिधारयन्. That snehanasya, when it is given in larger quantity, should not be gulped in, should not be swallowed. It should be expelled out, because if it is gulped in, it can produce a kapotklesha. Tattecha punarapi samsvedya galakapoladin dhumam aseveta bhojetyena anabhishyandi tato asya acharikam adishet rajo dhuma sneha atapa madhya dravapana shirasnanati atiyana krodhadini cha parihareta. After the nasya, svedana has to be done and dhumapana has to be done, and patient should be given a light food, and should protect himself from any excess of activity or exposure to the sunlight as such. तस्य योगाति अतियोगा अयोगान इदं विज्ञानं भवति लाघवं शिरसो योगे सुखस्वप्नावबोधनं विकारोपशमशुद्धिः इंद्रियाणां मनस्सुखम्. If the nasya is done properly, it produces lightness of the head and easy sleep and easy awakening, convenient one, and or maybe controlled sleep and controlled awakening. The diseases will be reduced. The pleasant feeling would be there. Indriyas, the sensory organs would be functioning better. Kapha praseka shiraso guruta indriya vibramah lakshanam murti ati snigdhe ruksham tatra avjarayet. If there is an excess of the sneha dravya, it produces kapha praseka, discharges from the nose, heaviness in the head, and the impairment of the sensory organs. And in such conditions, a ruksha nasya has to be given. अयोगे वातवैगुण्यम् इन्द्रियाणां च रुक्षता रोग अशान्तिश्च तत्र इष्टं भूयो नस्यं प्रयुयेत. If there is a yoga less than optimum effect, it can result in abnormality of the vata. The sensory organs will become dry, the diseases will not subside, and in such conditions another nasya has to be administered. चत्वारो बिन्दवः षट् वा तथा अष्टौ च यथा बलं शिरो विवेकस्नेहस्य प्रमाणम् अभिनिर्दिशेत. Now the bit of difference of opinion about the quantity. The other way, the quantity could be Shiro Vivekan's for the Nasya. Either it could be 4 drops or 6 drops or 8 drops. So either it could be the previous dosage mentioned like 8 drops, 1 Shukti or Pani Shukti, or it could be 4, 8 or 6 drops as such. नस्य त्रीणि उपदिष्टानि लक्षणानि प्रयोगतः शुद्धहीन अतिसंज्ञाने विशेषात् शास्त्रचिन्तकैः लाघवं शिरसः शुद्धिः स्रोतसां व्याधिनिर्दयः चित्त इन्द्रियप्रसादश्च शिरसः शुद्धिलक्षणं कण्डूपदेहो गुरुता स्रोतसां कफसंस्रवः मूर्तिहीन अवशुद्धेत् लक्षणं परिकीर्तितं मस्तुलुङ्गागमो वातवृद्धिः इन्द्रियविभ्रमः शून्यता शिरश्चापि मूर्तिगाढविरेचिते हीनातिशुद्धे शिरसि कफ वातग्नम् आचरेत् सम्यक् विशुद्धे शिरसि सर्पे नस्यं निषेचयेत् एकान्तरं द्व्यन्तरं वा सप्ताहं वा पुनः पुनः एकविंशतिरात्रं वा यावद्वा साधु मन्यते मारुतेन अभिभूतस्य वा अत्यन्तं यस्य देहिनः द्विकालं चापि दातव्यं नस्यं तस्य जानत. For the virejanic sneha, the virejanic nasya, the quantity should be 4, 6 or 8 drops where Tikshna Dravyas are used, and the Shuddha Hina Yoga, Ati Yoga or Samyak Yoga are almost on the same line. When there is a Samyak Yoga, it produces lightness of the head and the diseases will be controlled. Chittendriya Prasada, pleasant feeling of emotions and as well as the psychological status would be occurring. In Alpa Yoga or Ayoga, where the optimum, less than optimum results are seen, there could be eating upadeha, there could be stickiness of the mouth, heaviness or kapha, there could be discharges. And in Ati Yoga, Mastulungagamaha, there could be the cranial contents may be leaked out, vata will become aggravated, and shirasas shunyata, a light emptiness of the head would occur. These can occur, be the complications of Ati Yoga. Hinati Shuddhe Shirasi Kapavadam Achareta. In the Shina and Ati Shuddha conditions, you will have to treat the kapha or vata. After Samyak Shodhana, Nasyam Nishecheta, another Nasya has to be given, Sneha Nasya has to be given. Shiro Verechanika Nasya, Verechanika Nasya should be given in gap of either 1 or 2 days or 1 week. Maximum would be 21 days. The gap could be depending upon the patient's condition. If the gap has to be either a day, 2 days, 7 days or 21 days, depending upon the incidence of the dosha in the patient. And it could be given twice in a day whenever it is administered. Avapedanasya is another variety where some plant substance or raw plant substance is squeezed in. Because it is squeezed, it is called as avapedana. So swarasa of a substance is applied into the nose. Avapedastu shireverichanavad abhishanna as sarpadasta bisanyebhyo dadyat shiroverichan drabyanam anyatamam avapishya avapidyaja Sharkara ikshurasa kshira ghritam amsarasanam anyatamam kshinanam shunidabhitteja vidadyat Krishna Durbala Birunam Sukumaranam Yochidam Shira Sneha Shira Shuddho Kalkas Tebhyo Yathahidaha Cheto Vikara Krimi Visha Abhibannanam Chunam Tadameta. So either it could be the squeezed substance, so when you prepare a kalka and then it is squeezed, either could be the raw plant substances or along with the Sharkara, Ikshurasa etc. can be given. And indications are when either the person who has a snake poisoning like conditions, who is unconscious, or patients who are very weak and delicate, or for females, you may give Shrita Sneha Shirashdhihi, where the Sneha Dravya can be given in the form of the same avapedana. And if the patient has unconsciousness or if there is a poisonous content a churna, dry powder also can be blown into the nose. That also is considered as a variety of Savapidana or maybe the Abachurnan. नस्येन परिहर्तव्यः भुक्तवान् अपतर्पितो अध्यस्त तरुण प्रतीक्षायी गर्भिणी पीतस्नेहोदक मद्यद्रवो अजीर्णी दत्तबस्तिः क्रुद्धः गरार्तत्रिशितः शोकाभिभूतः श्रान्तो बालो वृद्धो वेगावरोधितः शिरस्नातुकामश्चेति अनार्कवे च अभ्रे नस्य धूमो परिहरेत. Nasya is contraindicated immediate after the food or maybe after apadarpana or in the recent stages of the cold pregnancy and after consumption of alcohol or maybe water, after basti and when the patient has emotional disturbances and after having thirst or patient who is tired in very young age or very old age, those who want to take bath now, and improper seasons like when the cloudy weather or seasons like cold weathers, it should not be given. तत्र हीनाति मात्र अतिशीत उष्ण सहसा प्रदान अति प्रविलंबित शिरस उच्छिंगतो विचलतो अभ्यवहरतो वा प्रतिषिद्ध प्रदानाच्च व्यापदो भवन्ति दृष्टोद्गारादयो दोषनिमित्ताः क्षयदाश्च. The defects of this nasya could be the quantitative abnormalities like hinati matra, or the qualitative like either it could be hot or very cold, or the administration techniques like rapid administration or very slow administration, or movement during the administration, sneezing during the administration can be the result can result in complications. नस्ये शिरोविलेके च व्यापदो द्विविधा संग्रह दोषोत्क्लेशात्क्षयाच्चैव विज्ञेयः यथाक्रमात् दोषोत्क्लेशनिमित्तस्तु जयेत्-शमनशोधनैः क्षयनिमित्तस्तु यथास्वं ब्रह्मणं हितम्. The two possible complications which can occur due to nasya could be either a dosha utklesha, dosha may become liquefied and but may not get expelled, or there could be dosha kshaya. The approach to the treatment is if there is a dosha utklesha, a persistent discharge after the sneha, then you have to give some shamana or shodhana dravya. Then if it is dosha kshaya, it should be given with the brahmana treatment. Pratimarshah chaturdasasu kaleshu upadeyah tadyata talpothitena prakshārita dantena grihan nirgacchata vyāyāma vyavāya adhvaparishramdena mutroच्चार कवलाञ्जनान्ते भुक्तवता छर्दितवता दिवास्वप्नोत्थितेन सायं चेति. Now, Pratimarshana is something which can be done every day where the quantity is very small, very few drops, 1 or 2 drops of the nasya can be given, and it could be given at any time of the day, and specifically there are the time given are 14 time gaps, and they are immediately after getting up from the bed, after the cleaning of the tooth, and as you come out of the home, and after the exercises, and after this evacuation of the bowel or bladder, or after consumption of kavala or anjana, and if at all there is a vomiting after vomana, after awakening from the day and at evening, and these are the timing suggested. तत्र तल्पोत्थितेन आसेवित प्रतिमर्शो रात्रौ उपचितं नासा श्रोतगतं मलपोहन्ति मनप्रसादं च करोति. If you the nasya immediately after getting up from the bed, it will remove all the doshas which are accumulated in the, at night, and makes gives a pleasant feeling. Prakshārita dantena asevita dantanam dharatam madana sugandim chapadeti. Nasya given after the cleaning of the tooth will improve the health of the teeth as well as the mouth. Grihan nirgachata sevita nasasrotas klinataya rajo dhumo vana bhadate. If you put this nasya before leaving the home, the pollution would not affect. Vyāyāma maituna adhvaparishramdena savita shramam vahanti. The stress would be reduced if you take the sneha after a stressful exercise. Mutroccārante sevitaha drisseha gurutvam apanayati. After consumption, after evacuation of the bladder, if the sneha is done, nasya is taken, it will improve the vision. Kavalanjanante sevita drishtim prasadeti. After Kavalanjana also it improves the vision. Bhuktavata sevita srotsam vishuddhim lagutam chapadeti. After consumption of food, it will help in facilitating the digestion and lightness, produces a lightness. Vantena sevita srota vilagnam shleshmanam apohya Bhaktakamsham apadayati. After the woman, if the nasya is done, it will remove all the kapha which is accumulated in the tract and it will improve the appetite. Dvasapnotitena asayivda nidrashesham gurutvam malam cha apohya chittaikagram janayati. If sneha applied after the sleep in daytime will reduce the heaviness and makes your concentration capacity better. Sayam chaseta spanidra prabodham janayati. If you put the sneha at the evening, it can produce a comfortable sleep and comfortable awakening. Ishad buddhingata sneho yavad bhaktram prapadye nasya nishtantam vidyata pratimasya pramanatah. The quantity of the sneha nasya is it should be just producing a feeling of irritation and the patient, and it should just be felt in the mouth. The taste of that would be felt in the mouth, and that's the quantity. It could be usually 2 or 3 drops. Nasyena rogaha shamyanti naranam urdhajatrujaha indriyanam cha vaimalyam kuriyada asyam sugandhija hanugandha shirogriva tika bahaurasam balam vali parisakhalitya venganam cha pyasambho. The advantages of the nasya would be it will prevent many of these diseases. Tailam kafe savate syat kevale pavane vasam dadyat sarpi sada pitte madhyanam cha samadute chaturvidasya snehasya vidhirevam prakirtitha shleshma sthana avirodhatpadeshu tailam vidhiyate. Taila is always preferable in case of nasya. The other would be if there is a involvement of Kevala vata, vasa could be used. In pitta it should be sarpi, ghृता should be used. And if there is a involvement of vata with pitta, then madhya could be used. But taila is indicated in all conditions. As I said about the nasal route of drug administration as one of the standard mode of administration of the drug now, the advantages are it is rapid, safe, and it avoids the degradation in the gastrointestinal tract and the reduction of systemic side effects. Also, bioavailability of the drug at low molecular weight drugs is better, and the drug is absorbed rapidly through the vascular mucosa. But at the same time, the disadvantage could be the drug gets eliminated immediately within a short duration. The total amount of the pharmacological activity is not controlled. It can even induce nasal congestion due to cold or allergy, which may affect the drug administration. It's only a limited quantity of the drug can be applied into the nose, and frequent use may produce damage to the nasal mucosa. The drug could be lost, or the quantity may not be measurable because of errors of administration, and the drug's mechanism of drug transport is not clear. There is a lot of confusion about it, as I told you about that. That's about the one. The next is about the Kavala Graha. अतःपरं प्रवक्ष्यामि कवलग्रहणे विधिं चतुर्धा कवलस्नेही प्रसादी शोधिरोपणो स्निग्धो स्नेही संयुक्यो बाते स्वादुचित्रैः प्रसादनः पित्ते कट्वम्ललवणैः रूक्षोस्नेही शोधनकफे कषायतिक्तमधुरैः कटुस्नेही रोपणे व्रणे चतुर्विधस्य चैवास्य विशेषो अयं प्रकीर्तितः. The कवलग्रह is some keeping the liquid substance in the mouth. It's mouth douche, maybe something like that issue, which is not a issue in the contemporary medicine. That kind of a practice is not there. Mouth wash is something different. It's not a mouth wash, it's a mouth douche, where the substance is kept in the mouth and the substance is facilitated to be absorbed from the oral mucosa. And that kind of a technique is not seen in the contemporary medicine. And this could be snehana, prasadana, shodhana, ropana, 4 categories. And when it is a stigdha usnehi, snehika, vate, when there is a stigdha usna dravya, it's for vata. And when there is a swadu and shita virya, and sweet taste, swadarasa, it's for prasadana. And that's mainly for the pitta vyadi. Katu amla lavane ruksha shodhanaha. When there is a katu amla lavana dravya and ruksha usna dravya, it's for kapha and shodhana. And for the Vranaropana, Kashayatikta Madhura, the drug selected would be same. Tatra Trikotuka Vacha Sarshapa Haritaki Kalkam Alodya, Taila Sukta Sura Mutrakshara Madhunam Anyatamena, Salavanam, Abhiprataptam, Upaswinam, Mrudita Gala Kapola Lalata Pradesho Dharayata. You should hold in the mouth the substances like Trikotuka Vacha, etc. And they shall be kept in as such in the mouth. Now, Mukham Sancharyate Yatu Matrasa Kavala Smraha.
असञ्चार्यात् मात्रा गण्डूषस्य प्रकीर्तितः तावच्च धारयितव्यो अनन्यमनसो उन्नतदेहेन यावत् दोषपरिपूर्णकपोलत्वं नासास्रोतो नयनपरिप्लावश्च भवति तदा विमुक्तव्यः पुनश्च अन्यो ग्रहीतव्यः इति. The gargling, when it's possible to be gargled, like when there is a movement of the substance within, that's called as Kabala. When there is no movement, just the quantity is kept in, where the quantity naturally will be more, is called as Gandusha. There is no equivalent English word for this. And it has to be kept in mouth till you have to have the feeling of a pariplava, that sensation of discomfort in the mouth as well as ears, eyes. Then only it should be spit out, and it should be kept in the mouth, concentrating on that process only, and after again it can be repeated. एवं स्नेह पय क्षौद्र रस मूत्र अम्ल संभूताः कषाय उष्णोदकाभ्यां च कबलाः दोषरहिताः. The drug which can be prepared will be based upon the dosha condition of the patient, and it should be prepared with either any oily substances or milk or maybe kshaudra, honey, or the mutra, gomutra, etc. Any of the substances could be used as a medium, and the other drugs could be added. व्यादेः अपचयः तुष्टिः वैशुद्ध्यं वक्त्रलाघवम् इन्द्रियाणां प्रसादश्च कवले शुद्धिलक्षणं क्षीणे जाड्य कफो उत्क्लेश अवरसज्ञानमेव च अतियोगात् मुखे पाकः शोष तृष्णारुचिक्लमाः शोधनीय विशेषेण भवन्त्येव न संशयः. The proper size, proper use of the Kabala and Gandusha can produce a comfort to the body, and the diseases can be subsided, and the indriyas, sensory organs, would be functioning better. If Hina Yoga, it can produce a heaviness or a disease-like feeling, and Kapotklesha can occur. The appreciation of the taste would be affected. If it is a Atiyoga, there could be ulcers in the mouth, dryness, and even excess of thirst can occur, and particularly in Shodhaniya Gandusha it can occur. Tilaha Nilotpalam Sarpi Sharkara Kshiramem Sakshodro Gandhavaktrasya Gandusho Dahanashanaha Kabalasya Vidirshesha Samasena Prakirtilaha. The Tilaha Nilotpala, these Shita Drabyas are used for patients who have a burnt mouth or healing, burning sensation in the mouth. विभत्य वेशजं बुद्ध्या कुर्वीत प्रतिधारणं कल्को रसक्रिया क्षौद्रं चूर्णं चेति चतुर्विधम् अंगुली अग्रप्रणीतं च यथास्वं करोगिणां तस्मिन् योगम् अयोगं च कवलोक्तं विभावयेत् तानेव शमयेत् व्याधिं कवलो यानपाहोति दोषज्ञं अनभिष्यन्ति भोजयेत् च तदा नरम्. A pratisarana is another technique of administration of drug into the oral cavity. Pratisarana word is used in different contexts. In Vranachikitsa, the word pratisarana has a different meaning, whereas Pratisarana in the context of this Kavalagraha and Gandusha, it's applying some dry powder into the mouth or kalka into the mouth, or rubbing that mouth with either kalka or rasakriya or paste of a drug or churna, dry powder, where you take it in the finger and then apply into the oral mucosa. That's the Pratisarana, and it also can be used for the diseases as a treatment. With this, we will conclude this chapter. It is Sushrutamsam Chikitsasthane Dhoomanasyakavala Graha Chikitsam Nama Chattarimshodhyayah. With this, we also will wind up the Chikitsasthana, one of the major milestone as such. With this, we will conclude today. If there are any questions, we will try to answer. Like there is one question: in which type of vrana should be dhupana should be done used clinically? I rarely use dhupana in the vrana, but theoretically, of course, it should be in contaminated wounds where there is a lot of slough and maybe foul smelling. In such conditions, dhupana could be done. But practically, I have not used dhupana in many conditions as well. Some trials were done in post-operative wound conditions, not much of a significant difference. That's right. Okay. With this, we will conclude today.